Insights from the world's best medical minds. You are watching therightdoctors.com.
Hello, good evening. I'm Dr. Sarat Chandra. I'm a consultant cardiologist at Virinchi Hospital and Indo US Hospitals at Hyderabad. I was past editor of Indian Heart Journal in the years 2012 to 14, and I was president of Cardiological Society of India in the year 2018. Now, I'm going to talk to you through the medium of therightdoctors.com, India's leading medical knowledge platform. We are going to discuss what we all can do to reduce the trouble that is being caused to our patients, to the hospitals, to the medical personnel, to the governments all over the world and in India specifically because of this coronavirus infection. You all know very well now about coronavirus infection. The disease is called COVID-19 because it started in the last month of 2019. The world is seeing a huge number of patients, although in some of the countries the disease seems to be coming down slightly. In India, we are now seeing an upsurge. In fact, because of the lockdown, perhaps our upsurge was delayed, and today we are seeing huge numbers, especially in big cities like Delhi, Mumbai, Chennai, and Hyderabad. With these numbers, the hospitals are clogged, the intensive care unit beds are all filled up, and the non-coronavirus infection patients feel very scared of getting into the hospitals where these COVID cases are present, and the doctors and healthcare personnel like nurses and other people getting infected. Some hospitals where certain departments have closed down because of this infection. Recently at Nizam's Institute, the entire cardiology department was closed down because of this infection. So what is it that we all can do about reducing this impact of this infection on the healthcare system? First of all, the government must realize that it cannot fight this battle all at its level. The government has seen that in the initial days, they said that we will treat these patients only in these big hospitals in the government sector. They said if you have a patient, you send them to one of these marked hospitals in different cities, which are mostly run by the government. And what happened over course of time, these doctors who are manning these intensive care units in the government hospitals, they got exhausted because of the duties. The level of care has come down. The ventilators and other infrastructure that is available in the government hospitals, as you know, is relatively limited. And now the government itself says you should take these patients into private hospitals. So it is now plainly obvious the government cannot fight this battle all on it. Take the private hospitals into confidence and evolve a system by which they can decide where the patients will go from which part of the city, what protocols that should be followed in private hospitals. If somebody does not have beds, what is the system by which they will send these patients to another hospital? Right now, we see a lot of patients going from hospital to hospital for 24 hours or so without finding a bed in the intensive care unit or for that matter in the hospital. And it's a very sad thing. More than one patient died because of inability to find a bed which is available in the hospital. This is happening in Delhi. I know here, and for these reasons, you need a systematic, workup towards this. How to organize this referral system? If a patient does not find a bed in a given hospital, how does he know where the beds are available? The government actually has to involve the private hospitals in a bigger way than this. They should also talk about the expenditure involved. You cannot simply say that do not charge more than a certain amount of money. Recently, the Telangana government has said that do not charge more than, say, a certain small amount of money for those patients who are hospitalized and a slightly higher amount for those patients who are on ventilators. It is completely impractical. The patients of COVID-19, once they are parked in a hospital, immediately the other patients are stopping coming to the hospital. So the hospitals actually lose their income, and the hospital has to continue to pay their employees, pay their doctors, and in fact many times they have to spend more than what they will spend for a routine patient in an ICU because of the requirement for the personal protection equipment and so many other precautions, disinfection repeatedly, and so on and so forth. So apart from this, the personnel have to be looked after better. Many of our younger doctors and our consultant doctors, our nurses are actually concerned about their own personal safety. There are examples for this everywhere, even in smaller towns in Maharashtra. You see the doctors getting infected, and a few doctors died also. So for this reason, we need to allay their fears, see to it that they are really taken care of. How do you take care of a patient once the patient comes into the hospital? What are all the precautions to be taken by the doctors who are managing the emergency room? And especially, what is the triage which they have? Earlier, the government said that you cannot do the testing also. Now, it's not possible to take care of these patients without doing the testing. So whatever tests are possible to do, the antibody test and the antigen test should be available for any hospital easily once they start looking after these patients. And there should be better reimbursement facilities also to be created for these patients, and the insurance companies also are to be roped in. The insurance companies, I would say, really they have not done a very good job in India as such. They have absolutely no idea how much is the cost in a given hospital for looking after. They just dictate terms to hospitals saying that we will pay only this much of money for a given case, no matter how many days you keep in the hospital or in the intensive care units. These impractical things have actually made the hospitals kind of saying no to some of the patients who are covered under insurance. And who suffers? It is the patient who suffers at the end of it. So if you want these COVID-19 patients to be really looked after well in the private hospitals, better reimbursement, better remuneration to the people who are looking after these patients, kind of compensation for taking the risk that they may be also getting infected in the bargain. Of course, we need to tell them to take all the precautions. We should do our best for them, but at the end of it, there is still a small risk, and there should be reasonable compensation for this. And the best possible medications. Today, there are so many medicines which are coming into the market. We know hydroxychloroquine, although there is some controversy about it, many of us actually believe that hydroxychloroquine can help in reducing the chances of infection as well as making the patient come out of the infection to a certain extent. Many of the doctors I know regularly taking hydroxychloroquine, including myself, because whether we are looking at COVID-19 patients, the hospital, these patients will come. And today there are so many. Yesterday or so, the Glenmark has brought in the favipiravir, and I saw today another news that Hetero is bringing remdesivir, and we all know that small dose steroid from the recovery trial is also helpful in reducing the mortality. You have the tocilizumab, which is available, which has been there in the market to take care of the cytokine storm in other diseases, and now we know that in COVID-19, one of the chief causes for death is intense cytokine storm, and therefore this also can be a very useful addition. The vaccines are also going to come sooner or later, maybe by November or so they will be there in the market available. And after saying all this, let me say that end it on a positive note, that this illness will reduce in its intensity and the frequency all over the world, and similarly it will happen in India also. We have already got examples in Spain and France, and to an extent in the United States. So the same thing is likely to happen in India too. And so let us look forward with optimism, and the government hospitals, private hospitals, insurances, all of them, insurance companies, all of them have to put their best foot forward to take our patients and ourselves out of this plague. Thank you very much.
Insights from the world's best medical minds. You are watching therightdoctors.com.